Chapter 37, Treatment of Lice and Scabies. We'll skip past the key terms because we will cover them in the chapter. Lice and scabies infestations affect people worldwide without regard for social status or race. They are caused by parasites that are readily spread from person to person quite frequently. A parasite is an organism that benefits by living with or on another organism, usually to the detriment of the host. Head lice most commonly infects children aged 3 to 11 years and their families, but anyone can become infested. And notice how it's in their family. So if one person has head lice in the family, everybody more than likely does, but if not, everybody does need to be treated. The parasite, Pediculus humanus captices, I think is how it's said, is spread between individuals through head-to-head contact. And this occurs during children's play and sports. Less commonly, transmissions occur by sharing personal items such as combs, brushes, hats, towels, scarves, pillows, and coats with someone who has head lice. Figure 37.1, A is an adult head louse. B is a picture of head lice infestation. That's kind of what it looks like. And C is a nit attached to a hair shaft. The cycle of a head louse is approximately 4 to 6 weeks. The adult females lay eggs, also called nits, at the base of the hair shaft. Within 24 hours of mating, they lay the eggs. In approximately 7 days, nits hatch and a nymph emerges. A nymph is a baby louse. The nymph becomes an adult in approximately 7 days, and the adult lives for approximately 30 days. Lice are parasites that feed on blood. This is why eggs are laid close to the base of the hair shaft, and nits that are found within 1/4 inch of the scalp are typically viable eggs. Newly hatched nymphs must be close to a blood source. Nit shells found farther than a fingertip away from the base of the scalp are likely remains of an earlier infestation. Treatment is not necessary in that case. An adult louse can live for up to 3 days away from a human host. Head lice are a nuisance, but they're not a health risk. It is a myth that head lice infestation is caused by poor hygiene, lack of cleanliness. Head lice do not live on pets. There is no human to pet transmission, so pets do not need to be treated. Pharmacy technicians may have customers coming into the pharmacy asking about head lice treatments. Because these products are available over the counter, they will be able to direct the customers to the correct shelf, which you will do quite a bit. Body lice infestations are caused by that parasite, Pediculus humanus corporis. Infestations are a serious public health concern because body lice may cause epidemics or typhus and louse-borne relapsing fever. Body lice thrive in crowded environments with chronic poverty and unsanitary conditions, so such as refugee camps, temporary housing from natural disasters, and prisons. The life cycle of a body lice is similar to that of head lice and begins with laying eggs. The nits hatch and nymphs mature to adults in 7 days. Adults can only survive away from a human host for 10 days. Pubic lice or crabs is sometimes classified as a sexually transmitted infection because it is usually spread through sexual contact. It is rare for lice to be spread through contact with bedding, linens, or clothes. Head lice do not inhibit the genitalia, and pubic lice do not live in the hair, so there's not going to be any cross infestations. It is a myth that you can get pubic lice from sitting on a public toilet seat. Scabies infestations are caused by a parasitic mite called Scabies. Scabii. Sure, that sounds right. The mite flourishes and spreads by person-to-person contact in environments in which the population density is high, such as hospital, nursing homes, childcare facilities, and schools. Transmission occurs through close contact and sharing bedding, linen, clothing, or sexual relations. Infestations are common and can affect anyone. The scabies mite burrows beneath the skin. Sites of infestation can be seen in the webbing between fingers and toes, skin folds of the breast, penis, and shoulder blades, and in the bends of the elbows, knees, and wrists. And box 37.1 lists symptoms of lice and scabies infestation. So, head and pubic lice, itching, feeling of something moving in your hair, genital area, sores from scratching, body louse, itching, rash, thickening, and discoloration of skin, scabies, intense itching, pimple like rash. Box 37.2 lists strategies to prevent reinfestation. So treat all infested and probably infested household members simultaneously. I highly recommend that every single person in the house is treated in order to prevent lice from jumping onto the untreated members and causing the infestation all over again. Use a knit comb to remove the eggs. Use daily lice combing between the treatments. Don't wash the hair for 1 to 2 days after the treatment is rinsed from the hair. That is very important. You don't want to wash off the treatment, and the treatment does work after it's rinsed from your hair. So you need it to work for those 2 days. Vacuum the floor and furniture in an infested household. They do have sprays. I think they say that they're not necessarily proven to work that great, but they do have sprays for your house. You should wash all clothing, linens, and bedding in hot water. Dry, clean clothing that is not washable. Place stuffed animals, toys, clothing, and bedding that cannot be washed or dry cleaned in a large plastic bag and seal the bag for 2 weeks. Shaving the head is not necessary to treat head lice. Just a little tech alert. Head lice may be treated with non-prescription and prescription pediculicides. Treatment is more effective if a fine-tooth comb is used to remove eggs from the hair shaft. OTC and prescription agents are effective treatments for head lice and pubic lice. OTC products are more effective and have a lower risk of toxicity than the medication Lindane, which was one of the first medications used for lice. Drug resistance is a growing problem for OTC and prescription pediculicides, especially permethrin, because of the residue left after treatment. Pediculicides that treat lice and or scabies are crotamatan, benzyl alcohol, isopropyl myristate, ivermectin, lindane, malathion, pyrethrins, permethrin, and spinosad. They're formulated in various dosage forms like shampoos, cream rinses, lotion, and household spray. Pyrethrins, permethrin, and isopropyl myristate are marketed for OTC use. Crotamatan is marketed as an OTC product in Canada, and it's prescription access only in the United States, which is all we care about. Pyrethrins are naturally derived from the chrysanthemum flower. Pyrethrins are indicated for the treatment of head lice, pubic lice, and body lice. Permethrin is a mixture of synthetic isomers of pyrethrins. It is more effective for the treatment of head lice, but less effective against pubic lice. It is also effective against the scabies mite. Pyrethrins are not ovicidal, meaning they do not kill the eggs. So retreatment is necessary in 7 to 10 days to kill newly hatched nymphs. Permethrin is ovicidal, though. Pyrethrins and permethrin paralyze and kill. Their action is discontinued once the drug is washed off. Permethrin does leave a residue on the hair that can destroy eggs and newly hatched nymphs. Pharmacy technicians should apply the warning label for external use only to prescription vials containing lindane lotion and shampoo. We wouldn't want them to put that inside anywhere. Permethrin is approved for use in children 3 months of age or older. However, the CDC recommends that manual removal of nits and lice in children younger than 2 years be tried first. So here's our chart of pyrethrins and permethrin. The first one, which is Rid, step 1, lice killing shampoo, RNC2, Rid home lice, bed bug and dust mite spray. These are in the US over the counter. And then permethrin in the US is available as Nix, and that's for the head lice. Nix cream rinse. And that is available over the counter. Also, some insurances do cover it, like Medicaid, so you might fill it in the pharmacy, but it is mostly bought over the counter. It's kind of pricey too, but I guess it's needed, right? And then Elamite cream is only available by prescription. It's 5%, and that is meant for the body, not the hair. Benzyl alcohol is used to treat head lice. It is only marketed in the US right now. It asphyxiates the louse. It is not effective in killing the eggs. So a second treatment is required 7 days after the primary treatment after the eggs hatch. Topical application is approved for people over the age of 6 months. So benzyl alcohol, the brand name in the US, it's not available in Canada, which again, we don't care about, but sometimes it's just kind of interesting to note that. Ulysfia, and it is available as a prescription only. Isopropyl myristate is not available in the United States, so I'm not going to talk about that. Ivermectin has been used for more than 20 years worldwide as a treatment for worm infections. It is also used for head lice treatment. So ivermectin is available in the US under Sclice and Sulantra. Lindane is an organochlorine pesticide. It is both a scabicide and pediculicide, killing all types of lice, scabies, and their eggs. It is a second-line treatment for head lice due to toxicity. It is absorbed through the body of the scabies, mite, and lice, where it paralyzes and kills the parasite. Repeated use causes accumulation and increases the risk for neurotoxicity. Lindane is neurotoxic and can cause illness, vomiting, seizures, and death if it is accidentally swallowed. The FDA has required manufacturers to place a box warning on the package insert to alert healthcare providers of the following. This should not be a first-line therapy, and a repeat application should be avoided. So this should not be like, oh, my child has head lice, and my doctor calls this in right away. No, this should be used after a few times of maybe not being able to get rid of them or toxicity. Malathion is an organophosphate pesticide used in agriculture to control pests and medically to kill head lice and their eggs. It is withdrawn from the US market and then reintroduced in 1999 following label changes. It's a prodrug that must be metabolized to its active metabolite, naloxone. It paralyzes the central nervous system of parasites by causing an accumulation of acetylcholine. The pharmacokinetics of malathion are dependent on the dose and the route of exposure. It is flammable, and those using the product should stay away from open flames, hair dryers, curling irons, lit cigarettes, cigars, and pipes. And that in the US is marketed under the brand name Ovide. Crotamaton is a scabicide. It is an alternative to Lindane that can be used during pregnancy. So that's Urax or Croton. It's available as a cream and a lotion. It is prescription only in the United States. Spinosad is a pediculicide indicated for the topical treatment of head lice infestations in patients 4 years of age or older. It is derived from Saccharopolyspora spinosa, a bacteria found in soil. Spinosad produces neuronal excitation in lice, resulting in hyperexcitation, paralysis, and death. The pharmacokinetics and degree of systemic absorption of spinosad after topical application has not yet been determined. Systemic exposure is not expected. The brand name for spinosad is Natroba, available only as a prescription. And now we have our summary of drugs used in the treatment of lice and scabies. So we have the usual dosage and dosing schedule in the middle box here. And we also have some warning labels we'll go over. So for instance, permethrin, lice cream rinse. So it should be applied to dry hair, so the hair shouldn't be wet. You should apply a sufficient amount of product to saturate the hair and scalp thoroughly. Let set for 10 minutes, then rinse hair with water and towel dry. Then use the lice comb to remove dead lice and nits and retreat in 10 days. So then we have the warning label, shake well, for all of these medications. Do not rewash hair for 1 to 2 days after treatment. Treat all infested and probably infested household members. Do not overuse product and shake well. And then, so that's just one example of all these other ones here. Remember, the last one is not available in the US, the results. And then we have the prescription only. So Shake Well is on all of these. The Scalice does mention that you should wash hands after applying, which is a good thing to note, probably with any of these. If you're especially applying these in your child's hair or maybe another person in the household's hair, I would not wash my hands. And if you have some gloves available or have the ability to get some gloves, I would suggest using those as well. For the Lindane, we have Shake Well. Do not rewash hair for 1 to 2 days after treatment. Treat all household members. Retreat in 7 to 10 days if crawling bugs are evident. And do not overuse product. Again, with the Ovide, it is flammable, so we should avoid flames. And Natroba should be, your hands should be washed after applying that as well.